afternoon, everyone, and warm welcome on behalf of Common Health and CREA. My name is Rupsha Malik, and I'm the Director of Programs and Innovation at CREA. CREA, as most of you know, is a feminist human rights organization. We are based in New Delhi and have been working for we completed 20 years this year, and we primarily work at the intersection of gender, sexuality, and rights. And Common Health and CREA, just for you all to know why this collaboration, for the last almost 6 years, I'd say, if not a little more, we've been collaborating jointly on a joint program to advance safe abortion in India, which has included running an annual institute called the Abortion, Gender and Rights Institute, and also supporting strategies to take forward some of the work in various states in India. I think before I hand over to Alka to talk a bit about, both the background and context for this webinar series, I just wanted to, flag that, we are living in unusual times. I think the COVID-19 pandemic and sort of the restrictions, I don't like the word lockdown, and sort of the impact we've been seeing on people's lives, I think more than ever starkly shows us the levels of marginalization, discrimination and stigma that hundreds and millions of people face in India. And more importantly, I think from the point of view of the work that some of us do on sexual and reproductive health and rights, I think there is growing evidence today of the kind of impact the epidemic and the response is having on just everyday needs of people to access sexual and reproductive health care. So I think it's against this backdrop we are having this conversation. Once again, a very, very warm welcome on behalf of Common Health and CREA. And we are very thankful that you all could make the time to join us for this webinar. I'm going to hand it over to Alka. Dr. Alka Barua is the abortion thematic lead at Common Health. And she has many decades of experience as an independent consultant and researcher in looking at some of these issues. Alka is going to be sharing sort of laying the context and the background for this webinar series. So over to you, Alka.
Thank you, Rupsa. So before we get into the actual presentations, I'll talk in very brief about the context of these 3 webinars. This is the first one of the series, and as Rupsa said, it's co-hosted by Common Health and CREA. Now, in case there would be some people who wouldn't know about Common Health, it's basically a coalition. Next one, please, Shani. Yeah. Common Health is a coalition of about 300 odd members, 30 institutional and 270 actually individual and 30 plus institutional members from more than 20 states, and it was launched in 2006. The vision of Common Health is to have a society that ensures the right to highest attainable standard of sexual and reproductive health for all, especially those from marginalized communities. And to sort of achieve this vision, a range of activities are undertaken at Common Health, such as capacity building and discourse influencing workshops for different groups of stakeholders. We are involved in building and disseminating relevant evidence and information amongst members. We support, facilitate, and mentor advocacy right from grassroots up to the national level. And there is an attempt to influence discourse and provide thought leadership. Next one, please. Though a Common Health vision talks about sexual and reproductive health, its focus has largely been on maternal health and safe abortion. And in fact, many of its founder members are those who are known for their work in this field. And the coalition has been involved in work on the issue of safe abortion since its inception in 2006. And the activities that has taken up is, of course, evidence building. We have worked recently in 4 states, Vadodara should be Gujarat, Bihar, Tamil Nadu, Gujarat, and Uttar Pradesh. We have published fact sheets, reports, blogs, monographs. We have conducted training and capacity building workshops, which in partnership with CRIA, which Rupsa talked about. We conduct meetings, workshops, consultations on range of issues related to access, gender, sex selection, and safe abortion. And we are involved in advocacy and using women's rights discourse and creating a common ground agenda for activists. Next one, please. Based on its 1.5 decade of work, some of the reflections that the Common Health members came up with are that though abortion is perceived as legal, seen as legal, in reality, listed conditions under the Act are exceptions to prosecution under the Indian Penal Code. And a woman in India still cannot decide for herself to have an abortion. Also, MTP Act, along with other laws and acts, can be and is increasingly used to prevent access to safe abortion services. Now, while amendments like the current one, which was passed in the Lok Sabha, are forward-looking to some extent, evidence shows that legal grounds alone do not help women access safe and affordable services. So we wondered whether it is the time to take the discussion beyond amendments to the MTP Act and change the narrative to women's right to safe abortion and perhaps even decriminalization of abortion services. With this in mind, we had sort of organized a meeting on 9th of December 2019 in Mumbai. Next one, please. Before I go into the issues which came up, there was a consensus. This was a meeting of a select group of people who have worked a lot in this area. And the consensus at this meeting was that there is a need for compiling evidence and conducting deeper analysis of the overall ecosystem and come up with a common framework and language within the twin track of legalization and decriminalization, which perhaps the lawyers who are going to take the next sessions will talk about in greater detail, or perhaps over the 3 webinars. The key issues that came up at this particular meeting was that are amendments to the existing act the answer to all the barriers to safe abortion that are currently there? And would legalization or act with amendments continue to give control to the state and nurture an atmosphere for exploitative processes? Then is decriminalization of abortion the answer to the prevailing barriers? But if we follow that path, is there a possibility of it leading to alienation of other groups and movements such as the disability group or the PCP and DT activists? And the most critical one, is the country ready for the right to abortion and decriminalization given its social fabric and prevailing political atmosphere? If not, what are the alternatives to respond to the ever-increasing barriers? Next one, please. With this in mind, we had scheduled another meeting with a larger group of allied and partner organizations, activists, and cross-movement members in partnership with CRIA, and for obvious reasons that did not take place. So we came up with these 3 webinars, and the objectives of these webinars are to bring together the partners and allied cross-movement members to arrive at a broad-based and common understanding of decriminalization. What should be the form? Should it be unconditional? Should it be reading down of the act, or should it be sort of something between legalization and decriminalization? And what would be the implications for access to services as well as safe abortion rights of whatever form we decide on? And to discuss advocacy strategies for that particular form of decriminalization within the existing political, social, and legal landscape in the country. So these were the objectives of this meeting. Thank you.
Thank you, Alka.
Yeah.
I think I'm going to just do like a short, very brief introduction to the first webinar. So the first one, we really thought it was important that when we begin to have this discussion on decriminalization of abortion in India, and as Alka already alluded to in her presentation, there are a number of things I think that need some sort of consensus building and some sort of coming together to build a common understanding amongst ourselves. You know, for us, I think many people who worked on the issue of safe abortion, I think for decades, the imperative and I think the approach was driven very much from a public health perspective. And even though there's been a very broad-based set of actors who've driven that and have, as a result, ensured access to safe abortion. And I think there's been also considerable work, even though it's not really translated into a number of amendments, but there's been considerable work, again, by the same actors to address the issue of legalization and particularly within the current legal framework of the Medical Termination of Abortion Act, Pregnancy Act, sorry. But I think what we observed, both Commonwealth and Korea, and I would think all of you, that there has in the last years been a growing body of thinking, agreement amongst a diverse set of people. Many of you are on this call and webinar on the need to really deeply think through and engage in a much more nuanced way ideas of decriminalization. And I think what Alka talked about, that what does the twin track approach to legalization and decriminalization look like? Is it at all going to be a twin track approach, or how do we need to approach the ideas of decriminalization? And so this particular webinar, the first one, really attempts to unpack some of those issues. And we also wanted to look outward to other movements who've had many more decades of deep engagement, often successfully, to address the issue of decriminalization faced by their constituencies and communities. So without much more, without speaking more, I'm going to invite our first speaker. Deepika Jain is a professor of law, Vice Dean Research, and Executive Director of the Center for Health Law, Ethics and Technology at the Jindal Global Law School. And Deepika is going to start us off by sharing her insights and providing sort of a context of the historical context of criminalization of abortion in India and some of the subsequent reforms. So over to you, Deepika.
Thank you, Rupsa and Alka, Suchitra, for organizing this webinar. I'm glad to be here. So what I'm going to do is I'm going to lay out the legal framework for abortion in India, both historically, the colonial legislation and the post-colonial legislation that was subsequently enacted in 1971. So I'm going to just take you through these two legislations and then talk about some of the contradictions when it comes to Supreme Court jurisprudence on abortion. So abortion is largely, as Alka was stating in her presentation, is largely a criminal offense under the IPC. Now, what is Indian Penal Code? So Indian Penal Code was enacted in 1860 by the colonial government, and it's a comprehensive criminal code that covers all aspects of substantive criminal law. Now, this code regulates not only sexual conduct perceived as violent, but anything that was considered divergent from the mainstream heteronormative framework. For example, forms of sexuality that were not rooted in formal alliances, like same-sex relationships, sex work, adultery, or even control of women's sexuality, which is abortion, etc. So now the law on abortion in India is primarily governed by section 312 to 316 of the Indian Penal Code. The section 312 to 3, and to some extent 313, criminalizes the act of miscarriage. So now this provision never uses the word abortion. What it does is it criminalizes the act of miscarriage, quote unquote, where the woman undertaking the abortion as well as the doctor facilitating the abortion are liable to be prosecuted, and the prosecution ranges from 3 to 7 years of imprisonment and fine, right? So that is the criminal law framework. Now, such provisions in criminal law, one may argue, may be required to address situations where a woman's pregnancy is terminated due to intentional bodily harm, domestic violence, medical negligence. However, by failing to make a distinction between the termination of wanted and unwanted pregnancies, the law makes it extremely challenging for women to access abortion. So then, post-colonial India, after 1950, 1960s, the government of India started considering reforms on abortion. The Shantilal Shah Committee report in about 1965 deliberated on this issue and recommended liberalization of abortion in India. And the reason cited for this liberalization framework was to put an end to unsafe or illegal abortion taking place in India, which are largely the cause for maternal mortality rates, the high maternal mortality rates. However, if you look at the document carefully, or even look at some of the legislative debates around the legislation, we know that the main rationale was population control, right? So it wasn't really a rights-based legislation as such. So moving forward in 1971, the Medical Termination of Pregnancy Act was enacted as an exception to the Indian Penal Code to exempt medical practitioners from criminal liability. So what this means is that the criminal provisions remain, the 312, the 316 remain, but as an exception to protect the doctor from prosecution and to allow abortion in certain circumstances, this legislation was enacted. So it's not a rights-based legislation. It doesn't talk about right to abortion. It doesn't talk about right of women in the entire abortion framework. Now, the conditions that the doctors had to follow in order to exempt themselves from criminal liability are the following. Number one, if there is a grave risk to the women's mental and physical health, including trauma of unwanted pregnancy for rape survivors or pregnancies of married women due to failure of contraception method, that is when the doctor can perform an abortion. The second is when the fetus has several abnormalities. So you can see from these two rationales that the legislation was not rights-based at all. What it was based on was a patriarchal, heteronormative, and eugenics rationale. Right? Now, arguably, any termination of pregnancy that does not fall within the rigorous confines of this very provision, Section 3 and Section 5 of the MTP, can be deemed to be a criminal offense. I'm not going to go into the details of MTP. Anubha is going to do that, the second speaker. But what I'm going to do now is just outline reasons why criminalization produces chilling effect on the exercise of reproductive autonomy. Right? So criminalization of abortion harms women, girls, gender diverse people in several ways. First, it is a major legal barrier to safe access to safe abortion. It has been well documented that banning or restricting abortion does not eliminate demand. It only eliminates access to safe abortion. Resultantly, in fact, unsafe abortion remains one of the major causes of maternal mortality globally. Right? Number two, criminalization allows stigma to run rampant as the media continues to be cloaked under an air of secrecy and criminality. The taboo surrounding abortion have a grave impact on women's health, play a significant role in their decision on whether to have a safe or unsafe abortion and whether to disclose the abortion to others. Combined, all of this produces a chilling effect on reproductive autonomy. So there is a need to rethink criminalization of abortion in India. This is the legal framework as far as the criminal law and the enabling legislation 1971 is concerned. Now, what has happened is very interestingly, post 2000, the Supreme Court of India, actually there are a bunch of cases where Supreme Court of India has recognized abortion and reproductive rights within the fundamental rights framework. So the first case was the 2009 case of Suchitra Srivastava, where the Supreme Court expressed very clearly that reproductive rights include the right to procreate or restrain from procreation, right? So that was one of the first articulation of autonomy and bodily autonomy and choice for reproductive rights within Article 21 of the Constitution of India. Subsequently, in 2017, in a landmark case of Puttaswamy, a nine judge bench decision, the Supreme Court recognized right to privacy as a fundamental right and included within its scope the bodily integrity, reproductive choice, and decisional autonomy of people who want to exercise reproductive choices. So while the Supreme Court has created a framework the framework of reproductive choice and reproductive autonomy, I would argue that largely this has been limited to the privacy framework, right? But has not yet articulated the link between gender equality and reproductive autonomy. However, in 2018, there are two significant cases which do that for us. So the Nafeed Johar case and Joseph Shine case, these are the two cases. The first one that decriminalized same-sex relationship, and the second one that decriminalized adultery. Now, these two case law, if you read them together with Puttaswamy, they unpack the notion of sexual autonomy and its link to reproductive autonomy. In these decisions, the Supreme Court articulate how the right to privacy and right to equality and non-discrimination on the basis of sex and gender come together to create an obligation on the state to eliminate laws that serve as a barrier to healthcare access and reflect discriminatory gender stereotype behavior. So these are transformative, in my opinion, these are transformative case law that create a a very strong rights-based framework for reproductive autonomy in India, and also make a case for decriminalization. I'll stop here, and we can discuss more during questions and discussions. Thank you.
Thank you, Deepika. So I'll quickly hand it over to Anubha, but I will introduce her. Anubha is a Mumbai-based lawyer, and she's been part of the campaign advisory group of the Pratigya campaign for safe abortion. And she is going to be taking it forward from Deepika and grounding her presentation a bit more specifically on looking at the current legal framework and the MTP Act. Over to you,
Hi, Rupsa.
Anubha.
Hi, Rupsa. Thanks. Thank you, Deepika, for setting out the basis of this conversation. So what I'll be speaking about today is more or less about what has happened in the past and what's happening currently to expand the existing legal framework to see legal and safe abortions, and then how does that really impact, or does it impact, the conversation around decriminalization of abortion in India. So I'm going to move with the presumption that most of us here today in this conversation are aware of what the MTP Act is, and what are the reasons that it lays down in which termination of pregnancy is permitted, to what time, etc. So I'm not going to go into that at this point at all. What I'm going to definitely touch upon is some of the litigation that has happened around this, especially in terms of say since June of 2016, and there is a Pratigya report on that also, where there was a sudden influx of cases that were being filed in the Supreme Court, where women who were pregnant and then did not want to continue with the pregnancy, and they were beyond the 20-week cutoff, were approaching the Supreme Court for permission to terminate the pregnancies. And so there were 21 such cases which went to the Supreme Court, and there were some yeses, some no's. I won't get into that. That report's available on the Pratigya website. And then finally, the Supreme Court said, you please go to your high courts. So then there were about 173 cases in the high courts that were filed and heard, and orders were passed till about April of 2019. We are currently in Pratigya tracking it from May of 2019 till April 2020, and I can already tell you that we have crossed, I think, almost more than 200 cases in a span of a year. So we will be analyzing those to understand, we are analyzing those to understand how many yeses, how many no's, and what the courts have been saying. But the point of laying that down right at the beginning was also to bring home the fact that there is now already a lot of conversation that is happening around access to abortion. And some of those cases which went to court were also gained a lot of media and public attention, like the 10-year-old girl, like the HIV positive woman who then passed away, but compensation was granted to her because the High Court had not acted within time. And there is already a lot of conversation that's taking place around access to abortion. And even though the law, the MTP Act came in 1971, for a large portion of time, people did not know that this was legal. And that brings me to what does it mean when we say it's legal? That it's, when we keep saying that, okay, abortion in this country is legal, but abortion is not a right. And like Deepika has already pointed out, that there is the IPC, which makes causing miscarriage of a woman an offense. And then from the IPC, there are exceptions which are carved out in the MTP Act. And it's only in those circumstances which the MTP Act is talking about is the termination of pregnancy legal. Otherwise, it's illegal and falls within the realm of the criminal law, that is the Indian Penal Code. So when we are looking at very specific reasons why a termination of pregnancy, how a termination of pregnancy, where a termination of pregnancy can be done, and by whom, if there is a movement in any of those and you violate any of those conditions laid down, then it becomes an offense. So while we say that abortion is legal in this country, It's legal in some conditions. So unless you fall within the categories that the Section 3 of the MTP Act provides, without that, it is an offense. Whether prosecutions have actually taken place under the IPC, that I don't think we still have that number. It's not a number that the NCRB data really captures specifically. And I would think that my understanding is that a lot of those cases would be tagged with other offenses, maybe domestic violence, maybe rape, so there it's not something that is specifically or on its own getting prosecuted. I don't know whether that's a good thing or bad, but so there is no statistic there's no reliable statistic as of right now on whether the 312 to 316 are actually being used, whether violations of the MTP Act are actually being prosecuted or not. So at this point in time in this country, abortion is legalized. But when we say decriminalized, what does that mean? To put it in very, very simple terms, it means removing any criminal sanctions that are there on accessing abortion. And you're ensuring that your legal system is not punishing anyone for providing a safe abortion. So obviously if there is medical negligence, or if it's a forced abortion, like if it's without the consent of the pregnant person, then all of that in any case falls within the realm of the criminal law. And even the wording of 312 to 316, the sections which deal with causing miscarriage, do differentiate between where the act has, or the offense has been alleged to be done without the consent of the woman and with the consent of the woman, and it looks at that in different degrees. So that distinction is already made. So one is not saying that when we are talking about decriminalization, and I'm already saying this out here because there's usually a lot of conversation on this that we get back, that you don't know how, what kind of negligence can be caused when women will approach anyone for terminating their pregnancy. But the fact remains that if it's done in a manner which is criminally negligent, if it is done where it is being forced upon the pregnant person, then obviously it is an offense. So nobody is saying no to that. Where we are insisting that it needs to be relooked, it needs to be read down, is where we are saying that the woman herself is also, the pregnant person itself is also likely to become an offender, is likely to be prosecuted. And in the manner in which access to abortion currently is, where a lot of times girls, women are able to access medical abortion pills on their own or on prescription or by paying a heavy fee for it, they are likely to be prosecuted under Section 312, where it clearly says that where a woman is causing miscarriage on herself, then she is also liable. So it is specifically, when we are talking about decriminalization, we are saying that you need to ensure that the law is not making a person who is seeking abortion a criminal, and is not making a person who is providing safe abortion a criminal. And that there is no, police investigation or any such thing that is, that gets involved, or that begins. And you treat abortion like any other healthcare procedure. So like any other healthcare procedure, you would ensure that there are norms, there are regulations. Not all healthcare procedures have laws in our country which are impacting them. In fact, childbirth, there is no law, but abortion, there is a law. So it also, like Deepika set out the context, it speaks volumes of where we've really got this from, and whether it's practical to continue with something like this. So the insistence on decriminalization, like I said before, is to ensure that in no way the pregnant person and the provider of a safe abortion is is under the threat of any kind of prosecution. And this, one can even have this conversation even when you're talking about situations like implementation of the PCP and DT Act, implementation of POCSO, etc. So it's not an either or, you know, and let me put that out right here. And of course, I'm sure there'll be some questions on that, but it's not an either or, that either you decriminalize or you will have the implementation of the PCP and DT Act. All of that can go hand in hand together. So it's not necessary for one to say that if we are talking about decriminalization, doctors will just do, or health professionals would do just about anything, and we will end up in a situation right before 1971. The reason why the MTP Act came into existence is where there were all these incomplete abortions that doctors were dealing with, women doing stuff themselves, etc. I think it needs to be contextualized in today's context when there is so much technology, there is so much information, and there is some amount of access. So why should law be an impediment to something that otherwise does not need to be monitored, to be regulated, unless the intention, of course, is to regulate sexual behavior? I'll stop here and look at questions.
We do have some questions that have already come on the chat box. I would request others to, if you can use the raise hand function to raise hand, I will call out. Vinod had a question, and I know Aparna is also responding. But Vinod, maybe you could ask your question, and Deepika can respond, and others are welcome to also indicate if they want to come in and add to that. So Vinod, please go ahead.
I was kind of curious to see how frequent is the cause of, the IPC has been applied. The reason I asked this is, one, just to get a sense of how much it is there, but also to weigh in the risk. Given the huge amount of abortion self-care happening, any of our conversations, advocacy around self-care, decriminalization, will it lead to unintended consequences? So that's the reason for my question from both perspectives.
Deepika, do you want to take that?
Yeah, hi. I'll take the first half, and Anubha can do the second part. So on Vinod's question, so this is one of the most common questions, that how many times has criminal law been used? Now, when we did our research, there was only one case we found where there was supposed to be a prosecution, because actually there is protection under Section 8 of the MTP, which says that if the doctor administers abortion in good faith, then there is protection, right? But there was one case where there was failure to sort of establish good faith. But I think the larger point of this any provision that has criminalization is the larger fear that it instills in the practitioners. For example, there are two things here. Number one, that the MTP is not based from the woman's perspective. It is not on woman's will or request. The abortion is at the behest of the doctor. Now, what happens is, if there is any doubt, any kind of doubt that the doctor is facing, what will happen is that because the responsibility is of the doctor, there is going to be, and there is a criminal provision looming over him, there is going to be a lot of caution on the behest of the doctor. But if the MTP was from the woman's perspective, it would have been different, because then the doctor would have had no liability, right? It was her choice to get abortion. So that is one aspect. But secondly, it's not important how many times, and I think Arvind will cover this in his presentation, how many times the provision has been used, but how it causes chilling effect on the current practices. That is what the problem with criminal law. And this is just one part, and Anubha may cover some aspects of POCSO. So the combination of MTP, the criminal law under IPC, plus PCP and DT, plus POCSO results in huge chilling effect. And we know that there are so many doctors that refuse to perform abortion in second trimester just because of these fears, right? So there is a very complicated web of legal sort of criminalization framework, which leads to these kind of complications and chilling effect.
Anubha, did you want to add anything to the second part of the question?
Um, uh, of course, in the chat box, one can see that Aparna Chandra has shared some of the data that she's aware of. I was not aware of the NCRB data here. So there is, of course, that, but of course, I would go with what Deepika said, that it doesn't really matter how many cases were done. And secondly, the point I would like to emphasize, which I did speak about, is that just because it is we are asking, or we are thinking about asking, or the conversation is beginning about reading down certain portions of the law which are making the woman liable for causing abortion, causing miscarriage to herself. It will not in any way impact the standard that any health professional is expected to maintain, is bound to maintain while while carrying out any medical procedure, be it abortion or anything else. So whether the fact that you can still be criminally liable for negligence, or there could be a civil liability on you under the Consumer Protection Act, that still remains. But where is the need to then have this extra sort of sword hanging on not only the provider but also the woman? And we are seeing that in POCSO. We don't know at this point how many cases have actually been done where mandatory reporting has not been done, and by a doctor, for example. But we know the effect of that, right? We know that so many RMPs refuse to now provide legal abortion, legal termination of pregnancy to a girl who's below 18 years old. So just the fact that it exists in the law book, whether it's being used or not, has its own impact, and has an impact where the only person who's really paying the price, in a sense, is that pregnant person and no one else. Yeah, I'll stop here.
I know Aparna is making some important points in the chat. So Aparna, do you want to just come in briefly and maybe share some of the things that you've been writing, just to supplement what Deepika and Anubha have been saying, and then I'll turn to the next question.
Sure, absolutely. I just wanted to make a couple of points. One is NCRB actually has been tracking in the last few years at least some of these abortion-related provisions. Unfortunately, what it is doing, and I think that goes to Deepika's point about clubbing all of this together, being a way to regulate women's sexuality, is that it clubs together miscarriage with the woman's consent and those without her consent. So we don't know what the breakup there is, but just to get a sense of volume, there are about 2,500 cases that the police investigated in 2018, and about half of them they couldn't find any evidence, so they had to file a closure report. I mean, the case didn't proceed beyond the investigation stage. So that's just to get a sense of volume, though of course, as Deepika and Anubha have both mentioned, it's more the chilling effect consequence rather than the actual prosecution. That's the problem. I just wanted to make an additional point that there are other laws that impose a range of civil consequences on abortion for the woman. And I think the biggest one is in matrimonial laws, where there are many cases which have considered abortion at the woman's behest without taking her husband's approval as cruelty, and therefore as a ground for divorce. Now, in other contexts, the Supreme Court has said that a woman has can decide freely on whether she wants an abortion or not, and this is not a decision that her spouse has a say in, but not in the context of divorce. And so what many doctors have told us is that they also fear that if they provide abortion services to a woman, they will be dragged into court in a divorce proceeding. So there's a range of these laws that, apart from criminal consequences, also impose civil consequences on the woman, and as a result bring her service provider into the legal framework and into the net of the legal process, which people want to avoid. So that creates additional disincentives and additional barriers for the woman getting access to abortion.
Thanks, Aparna. Vinod, I can see your hand up. Was it specifically in response to Deepika and Anubha's comments, in which case maybe you can come in and then I'll turn to the other people.
And I'll keep this brief. I think Aparna's point is very important in this whole thing on how do we frame this decriminalization. I agree with all of you saying that we are really looking at this from making it insulating women from any challenges of the legality of them accessing their right? We are not really, that's the focus. So given that, when we look at decriminalization, should we look at the other laws also which kind of put a restriction to them exercising? Now, MTP will play a big role, but are there other acts, other practices of law that impact this?
Thank you, Vinod. I'll go to you, Dr. Manisha.
Yeah, no, we have been now both Anubha's presentation. See, we are talking about decriminalization and hoping, to do a lot of advocacy. So we are talking a lot about decriminalization with a view to, protecting women, improving access, etc. But if you look at the acceptability by the government, if you look at the scenario over the years, there are a whole lot of quacks and unsafe abortion providers operating in our country. And if this regulatory landscape, if it's diluted, then actually we are exposing our women to more risks. Because like they did before, operated before, they'll do the same thing for monetary benefits. And also, this would also include those who do perform second trimester abortion, which are sex selective. And then another category here is the pharmacists who dispense medical abortion pills over the counter. And, of course, though we say that sometimes that is a harm reduction strategy in a way, where the women at least have access. But these are I'm just going on a bit to the negative side, though, I do support the decriminalization. But these are 2-3 issues which I just wanted to bring out.
Thank you, Dr. Manisha. Does anybody else have any other questions, comments? Otherwise, I'm going to let Deepika and Anubha come back in if they want to just make some concluding remarks, and we'll move on to the next set of presentations. So if anybody else wants to ask anything, yes, Atsa, do you want to come in and ask your question?
I was just wondering, this is a question to both Deepika and Anubha, if in the process of their engagement on this issue from legal and also engaging with health providers and sort of looking at both the sectors, if they have happened to chance upon, or if they're aware of any reviews being done on on the transaction or on basically orientation of doctors, the providers that we are saying here of abortion on these IPC sections, which we are saying is sending a chilling effect because it decriminalizes.
Do any of y'all want to come in, Anubha or Deepika?
Yeah, no, I think I'd like to take Dr. Malhotra's comment or question first. So, like I said, even when I was explaining what we are at least talking about at this point, and I don't know if it's going to get expanded or not, and I think that's the reason why we are all in this conversation trying to understand what this really means. So when we're saying decriminalization, does that mean that we need to throw out the MTP Act? I don't know that at this point in time. But what we are definitely saying is that the woman should not be criminally liable. So I'm unable to see how that would encourage quacks, or how that would encourage sex selective or gender-based abortions, etc., in any other manner than it was already doing. Because the emphasis here is that the person who is pregnant should not be criminalized to when that person is seeking termination of that pregnancy for whatever reason and for no reason, as long as that person wants to do it and there is enough to show that this is safe and that it is safe to do it at that point in time when that person is asking to do it, medically safe. So I don't see how that would by removing the criminal liability on the woman, how that encourages any other violations, even more than what it was anyway doing. Like even the PCPNDT Act has a clause in favor of the woman not being the one, unless you prove the contrary, that well, she also had an active part to play. Otherwise, the presumption is that she was under pressure to undergo any ultrasound, and where the sex of the fetus was revealed. So I mean, that's the point I want to make. And as far as the question that Adsa asked, I'm not aware of what's the content of the medical curriculum, and I think maybe Dr. Suchitra Dalvi would be a better person to answer that, or anyone else. I wouldn't know that. Deepika, do you want to come in?
Yeah, so on Dr. Manisha's question, I agree with Anubha. So I think there are two things that I want to say here. The first thing is that criminalization of abortion is gendered. We have to understand that in the current context of abortion, and it has disproportionate impact on women who must carry the burden of pregnancy and childbearing, right? Now, in the context of abortion, the larger question that we must understand, comprehend, to conceptualize is how do we want to understand crime, and how do we confront the state that increasingly wants to control women's lives and bodies, right? So on one hand, you will have this 312 to 316 provision. On the other hand, you will have the MTP, which allows for some autonomy. And then you have the Supreme Court saying that you have full autonomy. There are such contradictions that our women's lives are living in right now within the Indian legal context. So if you are going to decriminalize, it is not going to increase quacks or quack practices. In fact, you will now be able to access safe abortion. The doctors will not be intimidated to perform abortion on you. You will have the right. It will be at will that you can demand abortion. So I think it will only make things better. It can't complicate things further. Decriminalization will not complicate things further. The only concern that some feminist groups may have in this context is that this provision, 312 to 316, can be sometimes used by women, especially in the context of the criminal law reforms in India and the one rights that women have been fighting for so long on domestic violence and other aspects, that when this miscarriage is against the woman's consent and caused by, say, for example, domestic violence, mother-in-law, that then she should have recourse. But my question still will be, should that recourse be within criminal law, or should we seek alternative modes of justice? And these are larger deliberations we must have. I don't have any straightjacket answers right now, but this is the larger framework. And on the second question about the doctor's perspective, see, when we talk to, and Suchitra, of course, is a doctor, is a practicing doctor, she can answer this also. But I think most of them are intimidated by this multiple web of laws, which are all criminal in nature. So anything that is to do with crime in prison is intimidating, and the doctors are intimidated. And there is evidence to suggest that that's why they don't perform legitimate abortions which is within the legal framework in the second trimester, right? Because there is this complications about PCPNDT, the rigorous surveillance under that. Then the POCSO complicates many things for adolescent, younger adolescent girls and trans people. So I think we need to also think through many of these laws and look at how we can create an enabling environment and a rights-based environment for women to access, or women, or for that matter, I want to also say that it's not just women who are accessing abortion. There is also the larger context of gender diverse people accessing abortion. So basically pregnant people who access abortion, there should be a larger sort of a rights-based framework. And the Supreme Court is already moving towards that. So I don't understand why there should be laws that are archaic, colonial, and make no sense. They were constituted in a certain context in 1860. And they're not making sense now. And now this recent amendment, the 2020 bill, is anyway saying that abortion is for women who are also not married, and they've actually expanded certain scope. So, there are too many contradictions. And I think it's important to sort of do away with criminalization, at least, like Anubha said. I'll stop here.
Thanks, Deepika. Suchitra, do you want to quickly come in and respond to the question around medical education? And then I'll come to you, Dr. Rashmi. And that will be the last question. So, Suchitra?
Yeah. Thanks, Rupsa. Very interesting discussion. So a couple of points I would like to share. One is that the Indian Penal Code is very briefly shared with the medical students during forensic, which is the medical legal subject that we do. But as a gynecologist, I must say, all we were taught about was the MTP Act, and that too not within a context of rights, but within the context of, as a doctor, as a provider, you must do this to stay safe and within the law. And I think that's kind of the attitude that stays throughout, that it's all about protecting yourself, because nothing in medicine is really women centered or in any way gender sensitive or rights based. So that's one bit of it. The other part I want to just reflect on is, as a doctor, and as Deepika said, and Dr. Malhotra was raising the question, as a doctor, if I do anything negligent or anything that is harmful to another person, there are laws to protect that person. So this is again an argument I've often had. Some of you may have heard me say it before. So as a doctor, or if I remove your wrong kidney, for example, I'm liable to certain kind of prosecution. So why would we assume that for a woman to be denied being a mother because of my actions of whatever negligence and forced miscarriage is somehow over and beyond anything else, that it needs a separate law? Like, I would imagine that as a woman, if you remove part of my brain, which I can never get back, you should be liable to something more than if you remove my fetus, which I can always create again if I really want to. I know that's like oversimplification of the argument, but the fact remains that anything you do to another person which causes grievous injury or harm, there's already a set of laws. Why do we need a separate one for abortion, unless the hidden agenda behind it is to somehow control reproduction and sexuality, which women's bodies are meant to contribute to. In fact, today being Labor Day, we are having a discussion on it. So I'll just, with one last sentence to say that it's kind of a compulsory and unpaid reproductive labor that is being thrust upon women within the framework of patriarchy. And I think from that angle, if you look at it, then as Deepika said quite rightly, this kind of laws make no sense in any other context. Thanks. I'll stop there.
Thanks, Suchitra. Dr. Rashmi, you had a question. Maybe you can come in and ask the question, and that will be the last question. I know people are still putting in some comments in chat, but maybe we can come back to those at the end after we have the next two presentations. But Dr. Rashmi, please go ahead.
Yeah, thank you, Rupsa. This was a very interesting conversation. But what I really would like to emphasize is not just the legality of the abortion, the MTP Act, which, as Dr. Wright pointed out, most doctors know it simply as a way of protecting themselves. What is more important is what about the implementers of the law? The understanding of that law is very, very poor amongst the actual ground level, for example, the beat constable. So I'm sure Dr. Suchitra will understand when a woman comes in to have an abortion, she's in the right, we're doing the right thing. We're doing an abortion for an absolutely legal indication. She's right, we're right. But if somebody comes in and creates a ruckus, then why are you doing this? You're doing something wrong. Most providers would simply avoid doing that procedure just to avoid this kind of hassle. Is there any way that we have of spreading this awareness and ensuring this awareness to the ground level?
I don't know if there's any particular answer, but Anubha, do you want to come in and just respond? And I'll close this segment after that. And I do want to give enough time to the next set of presenters. But go ahead, Anubha.
Yeah, the problem with implementation is, I think, for almost every law that we have, and the fact that there is misuse of power and everything that comes with what the police can and cannot do and should not do. Like, I'm sure that a lot of you would also know of examples where where because of the mandatory reporting in POCSO, as a gynecologist, you do call the police, and then I've heard of a couple of examples where the police where the police personnel is actually negotiating a bribe with the girl and her family to make this case go away right in the gynecologist's office. So there is a lot that needs to be done in creating awareness. But let me also say that creating awareness and ensuring that there is no corruption or misuse of power are two separate things. So, in fact, one would find that because there is a lot of awareness, there is more space to misuse that power, and that really is, that's a completely different conversation, and which most definitely impacts each and everything that we do. but definitely it's not a one sort of solution that one can say ki, okay, maybe you should do this and the police will behave themselves, or whoever XYZ will do their job as they're supposed to. um, Yeah, no, of course, and even what Renu is saying in the chat box, that it is about about young people's sexuality, the girls' sexuality. If I have 2 minutes, I'd like to share an example of a case where I recently helped a girl in Pune, a minor girl, a 17-year-old girl in Pune, access abortion. And I mean, what would I do? I was only on the phone advising her what you can do. But the fact that when she and her mother, during this lockdown situation, when she came to know that she's pregnant and this was consensual sex, and then they went to access abortion in a well-known private hospital during the lockdown. And while she told the doctor what it was, but when the doctor said, I'm going to call the police, so she told the police that I don't know who did this. And the doctor got angry and said, listen, you're lying and I'm not going to do this procedure on you, so get lost. So then they had to go to someone else who sent them to someone else, and finally they landed up with another doctor. And then they had to go to the police station, lodge an FIR. So the mother and her young daughter, who's pregnant, sitting in the police station for about 6 or 7 hours, and they insisted to know who the guy was, and then she had to give the name, and the guy was arrested. Then she went back to the gynecologist saying that, okay, now that the FIR is done, can you please conduct the procedure? So then for that, the gynecologist said, okay, you come tomorrow. Then the next day, the gynecologist said that, no, I need it in writing from the police that I can conduct this procedure. Then I had a conversation with the gynecologist saying that there is no such need. And, now it's well within, if you think she, at 7 weeks, she should get an abortion, then you should do it. It's a medical opinion. But there was a lot of back and forth and she refused. So then we finally had to bring in FPI, and FPI doctors were so helpful, and she was able to undergo that procedure. Till date, the police is troubling her, saying that you either come and get your 164 recorded before the magistrate. And now, of course, because the boy's family has also woken up and they want the boy out, he, to the best of my knowledge, is still behind bars. And so now the police is coming and asking her to record that that I don't want to cooperate anymore, And so then I had a fight with the police person on the phone, saying that right from the beginning she was saying it's consensual. You didn't write it was consensual. Now because it's suiting you, you want to say that she's not cooperating, and then tomorrow when she goes to the judge and she will still continue speaking the truth, you will say that the girl is lying. So, and now all of this is happening within the realm of law. So what really needs to change in a situation like this is the thought process. Whether it was consensual or not, it still was an offense as per law is concerned. Then why can't you record the truth? Record the truth. No, she's saying it was consensual. It anyway is an offense. The law is such. So tumko likhne mein kya hai? But that's not how it happens. So there is a lot more that really needs to change. Yeah, Rupsa, please go ahead. Sorry.
So sorry, I'm cutting you short, but I do want to move on to the next segment and give that enough time as well. But we will hopefully be able to come back right at the end and have some of these conversations. I am noting some of the comments that is coming up in the chat box, and we can maybe turn back to some of those at the end. But now we're going to turn and shift gears a little bit and really spend the next several minutes learning from the experiences of other movements. I think there is a long history of advocating for decriminalization by the sex worker rights movement. And of course, we have the successful example of the very broad-based sort of efforts taken forward by a wide-ranging set of people to decriminalize homosexuality, which resulted in the reading down of Section 377. I think these movements, as we take our baby steps in thinking this through, I think we thought it was really important to hear from them because there are important lessons, I think, in the way, the kind of nuanced understanding approaches. How does one go about building both internal within movement sort of consensus as well as broad-based consensus? Because these are complex and contentious issues, as is already becoming evident. How does one delineate between the demand for legalization versus decriminalization? how do we address the issue of conflation? I think here we have a really important insights that we can learn from the sex worker rights movement in the way they've constantly had to balance between sex worker rights and issues of trafficking, where there's been deep, deep conflation. And I suspect for us, as we move forward this conversation, we'll have to contend with the decades-long conflation between abortion and sex selection. So I'm going to turn to our first speaker, both of whom, Tejasvi and Arvind have been waiting patiently. So Tejasvi is the executive director of Saheli Sangh, which is a sex worker collective and a community-based organization based in Pune. And Tejasvi is going to present on sort of the perspective from the sex worker rights movement and some of the work that's happened within the movement with regard to decriminalization. Tejasvi, over to you.
Thank you, Rupsa, and thank you, Dr. Alka and Dr. Suchitra, entire Common Health team actually. And I'm very grateful that I'm going to participate in this very important webinar. Yeah, when we talk about decriminalization of sex workers, I think sex work itself is very complex, as everybody can see and understand, because sex work per se is not illegal in India. That everybody knows. Some people actually don't know this, and that's why they believe that because sex work is crime in India, punishment is happening to sex workers and they're getting arrested, and rescue operations are taking place and all. But these two things are totally different. There is another confusion people usually have around sex work is that they always think entire sex work is trafficking, and which is not the reality. Trafficking needs to be treated very differently than sex work. So these two basic things all the sex workers right-based organizations are fighting for, and that's why decriminalization of sex work is the biggest demand we are doing for years together and having very little progress on that ground. Now, when we, I'm just talking about little bit around decriminalization, because there are different perceptions towards it, there are different approaches towards it, even among the sex workers right-based organization and sex workers collectives. Few people think that legalization should happen, legalization of sex work should happen, it will help, but there are many complexities. If legalization takes place, then you are giving your entire control to the state, and the experiences of sex workers dealing with state, there is no need to, I think, explain everything. So it says everything actually. So that is not going to be the demand for the sex workers collective in India. Another part, people think of partial decriminalization, because looking at the current law and the entire fixation with trafficking and sex work which people have in their mind, it makes things more complicated, and people will, they think that, you know, partial decriminalization might help. That means they will somewhere accept little bit of voluntary entry into sex work, but they will have severe punishment to the traffickers. Now, when we speak about partial decriminalization, there are many things which are practically not giving justice to the facts of the third party definition in the anti-trafficking law in India. The third party is the person or group of persons who are actually either taking the person against his wish to, and force her to do sex work, living on her earnings and all those kind of things. But there is a different reality where this third person, like this third party person, who might be an agent, might be a brothel keeper, might be a lover, might be the partner of the sex worker who is actually protecting her, actually supporting her. So this entire argument regarding the anti-trafficking law and the decriminalization is really getting very complex, and it is very complicated, and lack of political will is definitely hampering the entire process for the demand of complete decriminalization. And why the sex workers are asking for decriminalization is because there is no no space for accepting voluntary sex work in India. The other angle, why the political will is not there and why we are struggling so hard for so many years for demand of decriminalization of sex work, is that it is highly associated with stigma in our society, because obviously today sex work has not been accepted as a profession in India, it as work, as decent work. Today we are having this Labor Day, and the demand to accept sex work as work, sex work as labor is still pending, and not only from the government, but even from the mainstream society. So this is the struggle, and that's why everything is so complex when it comes to sex work. And there are different lobbies and groups in organizations who are working for sex workers, where the use of anti-trafficking law is rampantly done against sex workers, not just traffickers, but mostly against sex workers, because all the sex workers are treated as victims of trafficking, because there is no operations which are making the life of sex workers very difficult, and accessing all other services. So I will just pause here for my explanation about the need of decriminalization of sex workers. Now, when we speak about accessing the services, especially the reproductive and sexual health services and safe abortion, that entire stigma which sex workers do have in our society. Secondly, the legal complexities, where and the third thing, that the practical thing, like women who are working as sex workers, most of them, they are migrants. So they don't have many documents which any government healthcare provider or even a private healthcare provider will ask for when she's going for abortion, like her IDs, government IDs, which most of the sex workers don't have, because they are not the local women. They do migrate, and there is an issue of getting all those kind of documents as a citizen. It is a very complex process, and again, the stigma and limitations of law that affects the entire process to get those documents. So that becomes the issue. Accessing government healthcare services for abortion is not usually preferred by the women, because most of the women, the treatment they get from these facilities is very much negative. Women are getting treatment with a very big stigma, being a sex worker. On top of that, if she's living with HIV, then things are more difficult. Stigma gets doubled automatically. So, the treatment as a person, as a patient given to her is very different than the treatment given to any other woman in our society. So, accessing the healthcare facilities for safe abortion is always a big issue. There are many private practitioners who are indulging into abortions of sex workers with a tremendous high fees. They charge heavy fees from the women, and they help them with abortion. Unsafe abortion is also used to be quite common. You can see the reality that wherever the sex workers collectives are working, the rate of unsafe abortion is quite low. But wherever there are no sex workers collectives are working, that the unsafe abortion rate is quite high. Comparatively, brothel-based sex workers can access various services because they are together, and they do have some support to access the healthcare services for safe abortion as well as for SRHR related things. So these situations of sex workers matter, where they stay, whether they are associated with a collective or organization or not, whether they are brothel based or non-brothel based. So it is a whole range of issues associated with different types of sex workers in India. And I think looking at the complicated situations and living conditions and the legal status, things needs to be treated in those perspectives. You just can't have 1 + 1 = 2, that kind of answer when we address the issues of sex workers around SRHR and safe abortions. Yeah.
Thank you, Tejasvi. I think it's quite clear from Tejasvi's presentation that, when we are thinking about decriminalization of abortion and we think about all the diverse constituencies that are impacted by it, it's very important to remember that there are other criminal laws that are at the same time impinging on other rights. And I think to be able to think through our approaches and strategies, I think that sort of a broad-based inclusive analysis is very important. So thank you very much for that, Tejasvi. I'm going to now invite Arvind. He's currently the Director of Research and Practice at ARC International, but he has been a founding member of the Alternative Law Forum in Bangalore. But most importantly, I think he has been associated with the broad-based advocacy that was taken forward over many years. Kriya too has been a part of that and has been, and that has included arguing the constitutionality of the Section 377 before the High Court and Supreme Court. So we couldn't have had a better person to talk to us about decriminalization of homosexuality and the reading down of Section 377. So over to you, Arvind.
Hi. Thank you for inviting me for this conversation. I was very happy to listen to the first part because I learned a lot by listening to my colleagues who spoke just now. And I was thinking, in a sense, a lot of the concerns and the issues which came up both in the chat box as well as in the responses seem to mirror some of the issues we faced around the 377 struggle itself. Firstly, I'll start with the entire issue. How do you frame a struggle against a legal provision? Obviously, I'm quite sure that none of you wants to frame it as a struggle against 312 of the Indian Penal Code, because what does 312 mean to anybody else? 377 became something different because 377 after a point in time began to symbolize a whole range of other things, and that's the value of how a legal provision gets infused with a certain kind of a social meaning, and how do you infuse a legal provision with the social meaning? That's the question or the challenge in terms of the struggle which you have before you. And in some ways, the answer is already there, because what I picked up from the comments is it's really a struggle against certain kind of a patriarchal morality centered around sex and sexuality. That's really the basis of the entire struggle when you're talking about the right to abortion, the way you all have described it. Go back a little back to 377. If you're familiar with the provision, it says whoever has carnal intercourse against the order of nature with any man, woman, or animal shall be punishable with life imprisonment, etc., etc. That's the language of the law. And again, the question is, how do you frame a struggle against a legal provision such as this? One argument is you can say that, it's a struggle for the right against struggle for the right to sodomy. If you say the struggle for the right to sodomy, you're not going to get very far in terms of, again, the society we live in and the kind of political framework we are currently inhabiting. And again, go back a little bit in terms of the judicial responses. In the United States, am I audible, by the way, Rupsa?
Yes, you are, Arvind.
Yes, absolutely.
Okay.
Hearing you clearly.
Okay. I think that's also part of the challenge all of us face, right? Since we can't see anybody else, we don't quite, are you making sense or what is going on? Anyway, so if you go back in terms of this particular provision in the United States, in 1986, it was challenged in the case called Bowers versus Hardwick, and the court upheld its constitutionality. And the way the issue was framed by the Supreme Court is, does the right to privacy include the right to homosexual sodomy? The court said no. In 2003, when Lawrence, Texas, when the case came up again, the way the issue was framed is, does the right to privacy include the right to forms of intimate association? The court said yes, right? So there's a way in which the court responds to the bare act of sex, the courts in the kind of societies we live in, and the way they respond to when you think of the act of sex within the framework of intimacy, love, relationship, etc., right? And so they responded more positively. And again, if you go back to our own case history, it's a similar thing. If you see 2013 again was where the court saw homosexuals is nothing more, homosexuality is nothing more than a series of orifices and interfaces. That's the way the court hearings went on. And obviously 2013 we got the judgment that we did. Whereas in 2018 and 2009, the court was very clear. They said it's really about the right to dignity. And we're talking about right to dignity. It's your right to intimate choice over your body. It's the right to make choices about your life and of who you choose to be with. So the court was able to see a wider range of societal structures in which sex is implicated, and we're able to give a certain kind of dignity to the choice people make when they choose to engage in sex, intimate association, etc. So the first question is really, how do you frame it? And here the simple answer I'll put forward is, I mean, there's a lot of debate and there are many ways of framing it. The way of framing with which we went with is one of the frames we went with is the right to love. And why did we go with the right to love? I'll just tell you the positives of it. And this has been a debate which has gone on, and I'm sure some of my colleagues, even now, they say this guy's still going on with the right to love, and they'll have a strong objection to it, and a very fair objection as well, And from the perspective they'd look at it. But I'll tell you why I think the right to love makes sense, and what potentially one can learn about it for the campaign for the right to abortion. For me, the right to love makes sense from two perspectives. Firstly, in the Indian context, when you say the right to love, it's really about the right to intimate choice. And the right to choice is something which Indian society and the Indian state took down upon. So when you're asserting your right to choose, that's the fundamental way I've seen the right to love. And again, the reference point we've often used here is Ambedkar's Annihilation of Caste, where he makes the point that one of the ways the caste system will get destroyed is when blood begins to mix with blood. And he uses the phrase blood begins to mix with blood. It doesn't necessarily limit it intercaste marriage when you say blood begins to mix with blood. So you get a sense of the fact that your struggle in a society such as India, when you say the right to love, is really for a way of challenging the societal structures of caste and gender. And the questions of questions of religion as well. The hegemonies imposed by religious ideologies and the hegemony and the idea of a religious community as self-contained. You challenge all of these structures through the right to love. So the right to love, again, the way I'd put it, it's got a certain revolutionary dimension in the Indian context. In other contexts, you can argue it's a bourgeois right, it's meaningless right, but I'm saying in India it's deeply meaningful because people die to assert the right to love. Especially when seeing the range of intercaste, inter-religious couples in this country who have been killed by their own families for daring to love across lines of religion and caste. So the first question I'd raise is it a way, can you frame this in a broader sense? And again, framing it in a broader sense will mean that we have to go back in a sense to the legal archive to see if there are any cases one can pick up on, to make this kind of a point. And the case we went back to in the context of 377, again, there's a lot of parallels here. I think Aparna referred to, I don't forget the numbers, but 2,500 or so cases. Whereas in the Indian whereas in this, and she also made a very, very interesting point, I thought, Deepika made a very interesting point, that the consent and lack of consent questions was quite blurred. We didn't know where it was with the women, where the abortion was performed with the woman's consent and where without a consent. And 377 is the same problem, right? 377 is the omnibus provision where consent does not matter. So a lot of the prosecutions are for cases which involve non-consenting sex. So in fact, if you look at the case archive on consenting sex under 377, we were able to come up with, you won't believe it, a total number of 3 cases in the entire history of the use of the law prior to the more recent times when the range of recent arrests happened. Then, of course, the question, you get back to the question of why then challenge a law which has such minimal impacts? That's a big question. I think that's a question which some of you have raised, and I think it's a very important question. Why are we wasting our time and energy challenging a law when, at the end of the day, nobody's using it? So what's the song and dance about this law about? And Deepika's answer there was that it links, the law in a sense links up to stigma. Because if you look at the relationship of law to society, law can actually produce a certain form of stigma against a certain community. And in 377, we saw that in a very, very particular way. Because if you go to the police station and say you want to file a case of harassment or violence as a gay or as a person belonging to the LGBT community, very often the police would likely look at you and say that you're an offender, or you're someone who violates the law. You were someone who was there out there cruising in the parks, and you have the chutzpah to come and want to file a complaint now or blackmailing. That's a response you often get from the courts, right? From the police, from the policemen. So there's a way in which the court, the law creates a certain stigma which inhibits you from exercising your full fundamental rights. And give you one more example on this is when one of our colleagues filed a complaint before the National Human Rights Commission when he was being treated by a doctor for ego dystonic homosexuality, which is what the ICD-10 calls it, and he filed a complaint alleging some form of medical malpractice. The NHRC initially admitted the complaint, then later on said that there are allegations of an offense under 377, and 377 is there on the statute books, therefore we can't deal with it. So there are a range of ways in which the law became a block to accessing a full range of your fundamental rights. So the challenge for 377 was to, again, put it this way, had two dimensions. One is we had to look at the legal dimension, which is at the level of the police. If you're getting arrested by the police, it's a straight violation of your rights. And at another level, it's also about a way of challenging a societal morality around issues of sex and sexuality. And at the third level, it's a way of challenging the structures of the way structures of caste and gender operate in this country. So it had these three potential levels at which the law could be, at which the challenge to the law could work. So how can we think of a challenge to the provisions on abortion in a similar way? And strangely, I'm just going back and looking at some of the older material to see where some of the sources of inspiration came from. And I had done a paper much earlier, which looked at one particular case, a legal case in 1912 called Naushirwan versus Emperor in Sindh, where basically the story was basically this. Naushirwan runs a restaurant in Sindh. He meets this boy called Ratansi. They both exchange some kind of looks at a point in time. Then they both go to Naushirwan's room on the terrace somewhere. And they're engaging in what, by all accounts, should be an intimate act of sex, to which nobody need to know anything about. But as luck would have it, as a police officer with possibly a grudge, or we don't know why, was peeping through the keyhole, he saw what was happening and marched them off to the police station and filed a case at 377 against them. So the point of the story is to say that, what was the nature of the relationship between Naushirwan and Ratansi, right? And we don't know. We can only speculate on the nature of the relationship because the legal archive doesn't tell you what was going on between both of them. We know that they're engaging in a sexual act. That's about all we know. And one of the speculative thoughts was it also a form of love between both of them? Was it kind of a relationship between both of them which was there, and which is what were they inhabiting what we can call a little community of love, which is born before its time, right? And which didn't have the space to breathe, and they were creating a world ahead of its time. So that's the kind of speculative pathway down which I went. But I was very inspired actually by an essay by Ranjit Guha called Chandra's Death. If you haven't read it, all of you, I suggest must read it, because it's in the Subaltern Studies volume, and it's an 1850 account of a story really of a sister who administers what you'd call, I'll just read out to you a small part of it. This is the sister speaking. She administers this material to Chandra with a view to causing abortion, or with a view to causing miscarriage of the child. I'll just read out to you so you get a sense of what is at stake. I made a paste of the drug again at dawn and administered it to Chandra. That did nothing to destroy the fetus. The next day when I went again to the same Kali Bagdi together with my mother and Chandra, he gave us a herbal medicine which had to be taken thrice a day, and 2 tablets of Bakor Guli diluted in lime water. Yeah? So this medicine is being given. Then at about 1/4 the fetus was destroyed and fell to the ground. My mother picked up the bloody fetus with some straw and threw it away. Even after the pain in Chandra's belly continued to increase and she died, still 4 or 5 dondos left of the night. Chandra's corpse was then buried near the bend by my brother Gayaram, his brother-in-law, and my mother's brother Harilal. Right? And then they get on board another defendant who was the lover of Chandra. And then this is what he has to say, right? He says, I have been involved for the last 4 or 5 months in an illicit love affair with your daughter Chandra Chashni, as a result of which she is conceived. Bring her to your house and arrange for some medicine to be administered to her, or else I shall put her into big. That's part of the fragment of what is there in Chandrajit, which Ranjit Guha talks about, and I think it raises all the issues which we're really talking about. The why did Chandra choose to have an abortion? Again, what is the kind of choice that she had? Here it's a simple case where she's had an illicit love affair, and the man who was her lover is telling very clearly that, I've had a love affair with you. I take no responsibility as far as the child is concerned. I will put you in a widow's home. That's what I'm going to do to you. So unless you get rid of the child. So because of which then the sister gets into the act, and the sister consults this again, what we would call maybe a traditional healer or doctor, or how we choose to phrase it, who gives her this particular medicine. The medicine has the effect of getting rid of the fetus, the way the judicial archive describes it, but it also kills her in the process. Based on which the sister and the mother-in-law are tried for murder. And Ranjit Guha's question is this: what accounts for a loving sister to be treated as a murderer, and a former lover who so heartlessly betrays the person who he had loved till now, And the answer which Ranjit Guha provides gets back to our question of it's really a form of sexual morality, and where the burden falls most heavily on women, right? And here is this guy, he has a love affair, he will take no responsibility as far as he's concerned. He says, I'm done, it's you deal with your life. And so the sister, so that she can have some form of a continued life in this village, goes forward to tries to save Chandra, and in the process ends up killing her. So I think, in a sense, if you think of that as a frame, that raises a range of the issues which one is really talking about, and the issue of sexual morality and how it controls, demeans, and subordinates women and the choices that women can make, in spite of the fact that we have a constitutional framework. So I think the question is this: if we can get maybe from the 2,000 plus cases which Aparna talked about, you can figure out a range of cases which tell stories, right? Or what are the lives they impacted by these legal provisions, and based on that, we build a campaign around the decriminalization of that provision, while making the point, actually, it's not just a question of 312 going. It's really about changing a certain form of social morality, and social morality around sexuality. And the fact that this social morality and sexuality needs to change is already gestured to by the changing law of the Supreme Court, right from Sucheta Srivastava to the right to privacy, to Navdeep Singh Johar, to the Joseph Stein judgment. And that needs to translate into a ground level thinking and action. And here again, I guess what we can invoke again is the idea of what we call constitutional morality. Again, the interesting thing or the important thing about the right to abortion question, the way we're discussing it now, it's coming in the light of, as I think Deepika made the point already, in the light of a very well-established jurisprudence, where the right to choice and right to autonomy and right to dignity of women is recognized unequivocally by the Supreme Court. There's no ambiguity on that point at all. So now the point is, how does that translate into action at the ground level? How do we ensure that women's choices are respected? How do we ensure that women are not penalized unfairly and disproportionately for choices made by both men and women in the context of love relationships, intimate relationships, etc., etc. And here maybe one can just end with Dr. Ambedkar's invocation of the idea of constitutional morality, where he made the point, which again is reiterated in Navdeep Singh Johar as well as Joseph Stein, as well as Sabrimalan, where he made the point that the constitutional morality is not a natural sentiment. It has to be cultivated. And democracy in India is a top dressing on a soil which is essentially undemocratic. So the point being made is really this, we've changed the law at the level of the level of the Supreme Court. How does that change translate into ground level action? And I think that's a question which all of you are raising, that, end of the day, why do we need to get involved in struggle against 312? How does it matter to us? If that change is not going to be about changing a societal morality and a sexual morality, and challenging certain kind of patriarchal structures which underlie everything else. And so that's a question before us. How can the struggle against these provisions become a form of a campaign to assert the right to choice and the right to autonomy of women, and a challenge to social morality and sexual morality? I'll end with that.
Thank you. Thank you very much, Arvind. I'm going to open up for comments, questions. I did see some comments already posted, and feel free to direct your question to either of the two speakers, or generally if you want to make a comment. Amit, I did see you'd written down some comments. Do you want to share with the larger group?
No, actually, I just wrote over there that due to the criminalization of sex work, there are larger sex worker community can't access the basic health facilities. Like they are just visiting the hospitals, and the hospitals denied to access the health facilities. Even I have just looking in various part of country, the sex workers are complaining that they are just visiting to the hospitals, and hospitals denied due to their sexuality, due to their identity, because they used to have a usually have a sex with multiple people. So sometimes they are just denied due to their this identity. So I think we have to just focus on it, like because of their identity, no one cannot deny to the access of the basic healthcare facilities. Even though if they are just denied to the basic healthcare facilities, so what will be happen when the sex workers will get access to the abortion and SRHR facilities? So this is the serious concern for the sex workers and trans community as well.
Thank you, Amit. Acha, you had a comment?
Yeah, I was just briefly adding to what Amit had posted, but just to add to that, I think, I completely agree that somewhere it has to be about decriminalization. You know what Anubha and Suchitra had earlier mentioned, and we were talking about medical professionals. And just to share that at Sama, in our engagement and broadly as part of our engagement on gender-based violence issue, and a lot of POCSO inquiries come up. And what we have tried to see, because we conduct orientations and trainings with medical professionals, using the MOHFW guidelines, and what we see, and what I think Arvind also mentioned, that there is a large sense of interpretations. Because there's so many contradictions. So at least using those guidelines, what we try and, get across that abortion is also the first aid, is the first line of treatment. So even within POCSO cases, if you want to report, you report, but you cannot delay it. Now, one thing is to, of course, to transform, to find that, we are saying that, okay, well-intentioned and good-hearted people within these service providers, but at the same time having that enabling environment, a law that really recognizes, that is rooted in rights-based framework, it just becomes very critical, is what we have also constantly realized from our field engagement. We know for sure that this non-denial, because there's another IPC and CRPC section which says that you cannot deny, and that's also because these service providers, mostly with doctors, you do not in our interaction, we are saying that you do not want to be on the wrong side of any law. So it's a constant negotiation located in this, this big cloud of different sections, some of them meaning progressive while cutting down the other in when it comes to conflict.
Thank you, Acha. I'm going to have a comment or ask questions, Arvind and Tejasvi, and then maybe come back to you all. So Swagata, I think you were making a point about the whole framing of right to love and how you thought it was so pertinent when we think about adolescence.
Yes, absolutely. I mean, I've just been listening to all the speakers, and I think POCSO has really turned everything on its head. And, we see the access of adolescent girls to termination services particularly impacted because of POCSO. I mean, for doctors, somebody asked about mandatory reporting and if there's any data. And what we are seeing on the ground, I mean, data-wise, when I was part of the Center for Child and the Law, we saw mandatory reporting. I mean, reporting is mostly by parents and followed by the victim, and very rarely by, other, maybe less than 1% is by other people. But on the ground experience that we have in dealing with POCSO cases in Bangalore,
we find it's the doctors who call the police. And then the police insist, and the doctors insist that the parents become the complainant. So the doctor is not necessarily the complainant, the informant, but it's the doctor who triggers that entire process. And while hearing Arvind speak about the right to love, and just, how important it is to couch the way in which you present a particular issue. And I was seeing the other comments in the chat box. It's true. There is just no social acceptance of the fact that adolescents can have sexual feelings and can have sexual expression. So it's a long haul. Like, how would you really pitch that? Would it be a right to health frame, or would it be something else? One other thing I wanted to just share, that during the lockdown period, a colleague of mine was able to facilitate the termination of pregnancy of a girl who was 14 years old, 22 weeks along. And the Karnataka High Court, everybody just came together because this was a remote district in Karnataka. Within less than 24 hours, all reports were sought, petition was filed, and the Karnataka High Court heard it and disposed it within 2 days. So some things also work provided everybody comes together.
Thanks, Swagata. Aparna, I can see your hand up.
Yeah, hi, I had a question for Arvind. Hi, Arvind. I was wondering whether you could share some of the strategies that you all used on evidence gathering, because I think there's some similarities there as well. There's so much of stigma. There's a history of persecution, not prosecution. Many of those similar things that we're seeing here as well. How did you gather evidence and some of those very powerful testimonies that you brought to court? Because the legal archive, as you mentioned, is very blunt or very limited. It doesn't, for example, it doesn't tell you the nature of the relationship. A POCSO case, when it as Swagata was mentioning, the legal archive will say, oh, parents filed a complaint, and possibly the nature of the FIR would be that the girl in question was raped. As in that it was it was without a consent, that the element of the question of love will not factor into the legal archive at all. And going outside of the legal archive, evidence gathering becomes very difficult because people don't want to speak about it, etc., etc. So what were some of the strategies? Would you have any advice on that, on evidence gathering that could build the case both in court but also in the court of public opinion on the need for a change in our legal setup?
Thanks, Aparna. That's a great Sorry, do I go in now, Rupsa? Or you
Arvind, there's one more linked question. I just wanted Nandini to have that, because it's also something I think you can bring into your response. If you allow, I'll just let Nandini come in, and then I'll come back to you and then to Tejasvi. Nandini, please go ahead.
Yeah. So I'm just a little bit, I want to just flag that love again can be determined very morally, and means, it can be tied to institutions like marriage, and, and also like judged whether you had single partner or multiple partners. So I'm looking at it, I think a better way to frame it would be the right to pleasure. So that it can be, it cannot, like just to keep away the morality and the other things like that may come in. So that was my point. Thank you, Rupsa.
Thanks. Over to you, Arvind. First you, and then Tejasvi. You can come in after Arvind.
Yeah, thank you. Thanks to both for both the questions. Aparna, thank you for doing part of my work, which is, I should have mentioned the fact that, the prosecution or persecution point has a very, very important point, I think, which I'm glad you put it across. And in terms of how we gathered testimonies in a context of where there is a certain level of stigma and people not willing to speak out, you're 100% right again about that entire context. And I think here's where the link between a social movement and a legal process becomes so central or so key. Because it's very difficult, if not impossible, to get people to testify if they're not part of a process through which they're empowered to put forward those testimonies. Give you an example. Right? Some of the most powerful testimonies we got was this horrific rape by a transgender person called Kokila by the Baipanhalli police in Bangalore, and that emerged through actually an activist process, where the rape happens. She complains to the organization, which includes Vivida and Sangama at that point in time. They get together, they mobilize protests and rallies around the entire point. There's a week-long rally which happens in Bangalore. And there's an event in which, I mean, I remember that the person who spoke there was Gauri Lankesh. And the point which was made was saying that, these are the 4 police officers who are responsible for the rape of Kokila. And so I'm mentioning all of this because each of those had the strong participation of the community, right? And so people see that. They say, hey, if Kokila can speak up, so can we, right? And so there's a way in which courage is it's a collective process. It emerges because one person speaks or other people say, hey, so can I. And so that's how it happens. So it's a certain way of building a sense of community, a certain way of building up a larger community process, which allows for these narratives to emerge. Again, if you ask in 1991 and 1993, again, if you look at the archive, Siddharth Gautam's work in Delhi, you realize how difficult it was. The first report which came out, Leston Gay, he testifies to the fact that it's impossible to get people to testify in their own names. By the time of 2009, most of the Kokila testified in their own name. Were a number of testimonies in people's own names. A couple of testimonies still used pseudonyms or didn't want to put forward their names for obvious reasons at that moment in time. So I think that link between a social movement process and a legal process could result in getting these narratives or stories forward, as it were. There's also a bit of work done on inter-caste, inter-religious marriages, I think. And so, I mean, that again emerges from a political process within the feminist community and the Dalit community. And so that's ways in which we can maybe tap into those movements and see how we can get these narratives out. We say, this is our focus. These are the stories which we want. These are the stories we want to take forward because of a larger struggle for freedom from a certain kind of societal morality around sexuality. Nandini's question, again, it's an important question. I take it well that the notion of that there are many, many problems with the idea of the right to love. But I still hold on to this right to love only for one reason. I mean, maybe I know you won't be fully satisfied, but I'll say if we add the phrase subversive love to it, maybe that's one way forward. Because my interest in the idea of love is the fact that I don't think pleasure does the work we want it to do. End of the day, pleasure is individual. It's about you. You're getting your pleasure. How does it help the rest of the world if you get your pleasure? My point of the right to love is it is a way of challenging the structure of caste, the structure of religion, and the structure of patriarchy. And that is why the right to love is important. And again, I get your point. I mean, in the many, many contexts, because the right to love can very well end up supporting a status quo position. But I think we have to recognize the fact that India is a particularly unique kind of society. We can't transpose a Western framework onto the Indian context in terms of Western, not framework, I won't put a framework, a Western idea of the limitations of love onto the Indian framework. We have to see in the Indian context, we have to first recognize the advantages or the work that the right to love does in terms of challenging certain social structures, and then look at the limitations. But then that being said, again, I think this is a debate one has. It's not a final answer, as it were.
Tejasvi, did you want to come in on any of the comments or questions? Please do if you.
Yeah, basically about the thing, collecting narratives. I think that is very important, and it is very necessary to put firmly on the ground to create evidences and fight against decriminalization, this criminalization of sex workers and access of services, basically. And many of us, we are doing it. Recently, we have done a quite exhaustive survey and submitted it to CEDAW, the National Network of Sex Workers. We have done a survey on access to safe abortions among sex workers and what are the issues they are facing. I think across the entire population, many issues are quite similar. And basically it starts with the stigma and lack of documents and the way the sex workers are getting treated and why they are going for unsafe abortions. I think all these things are interlinked with each other and needs to be taken into quite seriously in accessing everything, actually, including the government healthcare services.
Thank you, Tejasvi. Geeta, I can see your hand up. Please come in.
Yeah. Hi, everyone. Arvind, I couldn't resist. I thought I wouldn't say anything, but here I am. So I think what I was going to say is, somewhere we also, when we use the word right, whether it's for pleasure, whether it's for love, what does that invoke in terms of the role of the state? And so one of the ways in which I think about the right to pleasure, or rather the right to pleasure, the right to love is more like a t-shirt right. You put it on your t-shirt and you go march. I don't want the state kind of guaranteeing it on anyone. So that's one. I think when we've talked about pleasure, we've at least said, can we differentiate between right to pleasure versus right to seek pleasure? So the word seek becoming more about, an enabling environment, agency, choice. So that was my second point. And my third point is sometimes it's hard when we use these words and we put a verses into kind of positive ideas, whether it's pleasure and love and whatever meanings they hold, because already there's been such a struggle, especially in the feminist movement, to even build out a language around pleasure. We have spent so much time in our life as feminists creating and crafting amazing language, necessary language on violence against women or gender-based violence. We haven't done that work with pleasure and love. So I don't want to get into what is better or worse, but I was thinking more as to why even say pleasure versus this, or this is less, there's a hierarchy between them, depends on who's talking. So I'll leave it at that. Thanks.
Thanks, Geeta. Is there anyone else who wants to come in, make a comment?
Can I respond to that? Or?
Yes, Arvind, you can respond to that because it doesn't look like anybody else has any additional questions, comments. So how about I let you and then Tejasvi maybe make some concluding points, and then we can just open up for a wider discussion. So Arvind, please go ahead.
Yeah, again, thanks, Geeta. I mean, this again, I see this as a continuing conversation. I don't see this as a full stop in of anybody having the right answer, as it were. And I think my point is only to say that this is one way of framing it. Or this is the way. My point was to say why frame it as the right to love and the work that the right to love does. And Geeta's counter is a very good counter. Her counter is to say that when you frame it as the right to pleasure, you're talking about something which patriarchy, as far as the way patriarchy operates, it denies the fact that women have a right to pleasure. So in that context, it's very important to talk about the right to pleasure. So I'll just maybe put it as a contextual response, saying in some contexts, you have to stress on the right to pleasure. I completely get that. Other contexts, you may want to choose to stress on the right to love. But on the other point, which once again I can't resist coming in, on the point of the right being a t-shirt right, I just make this one response. I'll say that to me, the way I understood rights are a product of communities in struggle and people in resistance. And I think if you have any rights at all in the Indian context, it's because of struggle. So I think the importance of these rights, the language of rights, is that it embodies behind it a certain history of mobilizing and a certain history of struggle. If you take just one example, if you take the articulation of the Constitution of the right of the criminalization of untouchability, or you take the articulation of the Constitution of every person having the right to access water, regardless of discrimination on the caste or religion, that is a product of a historic kind of a struggle. So I'll just make that one point. Again, to say that that's just one point, and to take the point well, that rights have limitations. We use them when we have to, and with the other frames, which may be more useful at certain other points. That point, well acknowledged.
Thank you, Arvind. Tejasvi, do you want to make any concluding points?
Yeah, I think we need to look into the larger picture. That's what the Times says, actually. Looking at the situation being very complex, and I hope that Arvind will agree with me that the fight of sex workers is mostly not in association with other mainstream feminist movements to the extent which is expected. And that's why see, actually, if you see the historical thing, like the history of the LGBTQ movement and the sex workers movement, I think sex workers right-based movement is actually the earlier one. It has a more long history than the LGBTQ movement in India, especially I'm talking about. But when it comes to getting decriminalization status, I think sex workers are still struggling, and still it is a dream for them. And unless we have a concrete support from the feminist organizations and the entire feminist movement in India and abroad, because there are some confusions and debates around trafficking and sex work among feminist organizations. I think once we have everybody is on the same page, things are going to be tricky for sex workers. So that dialogue is also equally important, and I'm really thankful to CRIA and Common Health to give this platform to have this kind of discussions very openly. Thank you. That's all.
We're not going to still end. We've got 5 minutes and we have 2 hands. So Deepika, it's been fascinating and absolutely enriched discussion. But Deepika, over to you and then Amit.
Yeah, hi. Thanks, Rupsa. I just wanted to, respond to what Arvind was saying. Actually, it's really helpful to understand, how to sort of work together as a multiple stakeholder, community, because abortion is a complicated issue. As we know, we've been speaking about it amongst us, and it needs wider conversation, wider information, and wider deliberations, right? So, and this is, I think, one of the first sort of ways to do that. But I think to Arvind's point on strategy, I think it worked differently for 377 because it was, like he said himself, that it was a different issue. The framing for me has already been done by the Supreme Court, right? The framing is within all the rights between 14, 19, 21. But how do we reconcile multiple laws that exist within criminal and civil framework? How do we look at Dalit and Adivasi women's access, which is highly marginalized, not just because of the law, but also access to barriers to healthcare system? How do we think through a case which was done in 2016 in Chhattisgarh, the Kajur case, where the woman, Adivasi woman was raped, and then they refused to file an FIR. She went to one hospital, they moved her to a second hospital, and finally she went to the court. Now the thing is, MTP does not provide any provision for you to go to the court. Why must you go to the court? You must go to the court because the systems don't allow you to navigate the legal process, right? And criminal provisions there are also responsible for this kind of larger roadblocks. And finally, when she goes to the court at 21 weeks beyond the limit, the court thankfully allows it, right? So we're very grateful that the court allows it. But there are also instances where the courts don't allow it, and then women have to carry, or young girls have to carry their pregnancy to term. So what I'm trying to suggest is there are multiple issues and multi-layered, complicated issues, but we are not where the conversations for other issues have been historically. For example, just trying to sort of build an evidence is really important, but how do we frame it? I think the Supreme Court has already done that work for us. The recent reforms will do that further for us. So I think we have to look at it also from a different dimension, though these conversations are very helpful. And I agree with Geeta on framing this versus framing that. While some of it can work for litigation strategy, we should not engage in any kind of litigation that will compromise rights for other groups. For example, if you look at love and pleasure, there are sexual minority practices that may get marginalized in the process, right? For example, BDSM, kinky, the kink and the law. So there is also this larger nuance that is really important and fundamentally should be factored in when we have these conversations. And I believe this is one of the first conversations which is bringing many people together. And we must have many more before we even think of what kind of legal change, but at least there should be an agreement of what the fundamental problems are.
Thank you, Deepika. Amit, do you want to come in?
मैं बस एक सुझाव देना चाहूँगा because ये जो चर्चा चल रही है उसमें आज लेबर डे है और डिक्रिमिनलाइजेशन ऑफ सेक्स वर्क के साथ साथ जरूरत इस बात की भी है कि हम सेक्स वर्क को वर्क की तरह समझने की भी कोशिश करें, बिकॉज आज कोविड के दौरान सबसे ज्यादा दिक्कत इस बात की हमें समझ में आई है कि अगर डिक्रिमिनलाइज होता सेक्स वर्क, अगर उसको एक काम की तरह ही देखा जाता तो सेक्स वर्कर्स के साथ पूरे देश में होने वाली इतनी समस्याएं शायद नहीं हो पाती। जो गवर्नमेंट की सर्विसेज हैं, जो सोशल सर्विसेज हैं, वो इजीली सेक्स वर्कर्स तक पहुंच पाती, बिकॉज उनके पास अपनी एक आइडेंटिटी होती जो और माइग्रेट लेबर्स के पास है और कंस्ट्रक्शन लेबर्स के पास है। तो आई थिंक ये बहुत इंपॉर्टेंट हो जाता है अपने आप में आज के दिन को भी देखते हुए कि डीक्रिमिनलाइजेशन ऑफ सेक्स वर्क के साथ हम सभी लोग कम से कम खुद ये जानने की समझने की कोशिश करें कि सेक्स वर्क एक वर्क क्यों है और इतने सालों से सेक्स वर्कर्स इसकी आवाज क्यों उठा रहे हैं।
शुक्रिया अमित। वेरी वेरी इंपॉर्टेंट पॉइंट दैट यू आर मेकिंग। ये बहुत जरूरी बात है और सबको पता है हाउ द सेक्स वर्कर कम्युनिटी हैज बीन सो टेरिबली अफेक्टेड बाय दिस पेंडेमिक एंड द रिस्पॉन्स। साथ साथ क्योंकि कुसुम के हाथ भी ऊपर है, तो कुसुम आप भी बोलना चाहेंगे कुछ, तो प्लीज आप बता सकते हैं अभी।
रुक्षा, मैं अमित के साथ ही अपनी बात जोड़ते हुए ये कहना चाह रही हूँ कि जैसे कि अमित ने बताया कि अभी कोविड के दौरान जो हालात हैं हमारे देश में, मजदूर वर्ग जो डोमेस्टिक वर्कर थे और जो बाहर मजदूरी करने वाले थे, लोग अपनी डिमांड लेके बाहर आ रहे हैं कि उनको पता है कि उनके काम को उस तरीके से नहीं देखा जा रहा। उनको कोई प्रॉब्लम है तो वो बात कर रहे हैं, वो अपनी समस्याएं बता रहे हैं, पर सेक्स वर्कर उस तरीके से सामने नहीं आ पा रही है। अपनी मजबूरियां, अपनी परेशानियां जो इस टाइम उनको हो रही है, वो नहीं बता पा रही है सरकार को या किसी भी चीज, किसी भी संस्था को। सबसे बड़ी दिक्कत आ रही है जो घरों में से निकल के बाहर सेक्स वर्क करने जाया करती थी सेक्स वर्कर, होम बेस्ड सेक्स वर्कर, उनके घर का पता किसी को इतना नहीं पता है, कोई सुविधा उन तक नहीं पहुंच रही है, उनके घर में छोटे बच्चे भी हैं, उनके घर में बुजुर्ग माँ बाप भी हैं, उन तक वो सारी चीजें नहीं पहुंच रही है इस टाइम जो पहुंचनी चाहिए। और उसका जो नुकसान हम लोग उठा रहे हैं वो यही है कि सेक्स वर्क को डिक्रिमिनलाइज नहीं किया गया, सेक्स वर्क को उस काम की उस तरीके की नजर से नहीं देखा गया जो और किसी भी वर्ग के काम को देखा जाता है। तो उसका खामियाजा हमें भुगतना पड़ रहा है बार बार हर हालात में। इस समय इतनी समस्याएं हैं कि दवाइयों को लेके, खाने को लेके बहुत ज्यादा समस्याएं हैं। जो सेक्स वर्कर खुद अपने घर को चला रही थी वो आज घर में बैठी हुई है, तो उनको घर को चलाने वाला कोई भी नहीं है। तो ये बहुत सारी समस्याएं हैं जो आज के टाइम में आ रही है और आने वाले कुछ महीनों तक ये समस्या उनके साथ रहने वाली है। यानी कि मेरे को लगता है कि 2020 तो समस्याओं के साथ ही निकल जाएगा, तब जाके बाद में कहीं जाके सेक्स वर्कर की लाइफ ढर्रे पे आने वाली है।
ये बहुत जरूरी बात है, and I would really request everyone who's on this call. There have been a multiple kind of efforts been made by both the All India Network of Sex Workers and the National Network of Sex Workers. All the representatives of these networks, they are part of this webinar. I would request you all to look out, and if there's a way to come out and support, I would really encourage you all to think about it. I think this is the time for all of us to stand in solidarity with each other. So yeah, absolutely, Kusum, ये बहुत जरूरी बात है. We've kind of reached 4 o'clock, and I'm conscious of the fact that all of you all have spent 2 hours on this, what I think a very engaging and interesting discussion. And I think all our speakers, Deepika, Anubha, Arvind, and Tejasvi have got us off to a really important, substantive start. I hope in the coming webinars we can build on some of these discussions. I'm not even going to attempt to try to sum up, because it's impossible to sum up these wonderful, rich presentations. I hope all of you found it useful, interesting, and I hope you continue to engage with us through the next 2 webinars. The next webinar, which is going to be on access to abortion services in the context of government programs, pandemic health crisis, and changes in abortion laws, is next Wednesday, 6th May, again at the same time, 2 to 4 p.m. And the details, it's going to be the details of the Zoom details are actually in that PDF document that was shared by Alka, but we will send out a reminder a day before. And I do hope all of you will continue to join these conversations over the next 2 webinars, and we continue to build on these conversations. But thank you everyone, including Arvind, Tejasvi, Deepika, Anubha, for really setting us off to such a wonderful start. And thank you everyone for your time and your engagement. And we look forward to having you all again next week on Wednesday. Thank you and bye-bye.
Thank you, Ruksha.